Okay, this is a case-based presentation. So an interesting case, a herd-level case that I saw in Australia that was associated with that caused hind limb weakness over a prolonged period of time. So this particular case occurred on a dairy farm located in the Illawarra region of Australia, which is about 115 kilometres south of Sydney and 5 kilometres from the coastline. It occurred in a year-round calving herd that milks 175 Holstein cows. It is a herd that has a pasture-based diet, so grazing kikuyu pasture in summer and autumn, and ryegrass pasture in winter and spring, and supplemented with 9 kilograms of concentrates per day. And those concentrates consist of 5 kilograms of wheat, 4 kilograms of dried distiller's grain, acid buff, a small amount of sodium chloride, 11 grams of limestone, 2.8 grams of mag oxide, 23 grams of vegetable oil, and 30 grams of a micromineral supplement. And at the time that this case was presented to me, which was in March 2017, the herd was averaging 22 litres per cow per day. And this area of Australia being so coastal, has quite good rainfall and quite consistent rainfall at different times of the year. So the case, the farmer reported that over a period of at least 2 years, he had been seeing cases of hind limb weakness, so cases of unilateral or bilateral mild flexion of the metatarsophalangeal joints. And when this happened in a particular cow, it would last for several weeks, and after several weeks of showing this mild flexion of the metatarsophalangeal joints, it would either be followed by spontaneous recovery, or it would be followed by sternal recumbency, so a downer cow. And the farmer reported that of all the downer cows he had had that had shown signs of this symptom, he had never successfully had one recover. It typically affected cows that were 80 to 120 days in milk. So not quite the peak lactation cows, but the cows that were sort of towards the end of peak lactation, so just post-peak lactation. And typically at any one point in time, he reported that he had about half a dozen cows that showed this hind limb weakness at any one point in time. He'd reported the syndrome to other vets over 2 years, but hadn't had any answers. So at this point in time, I'm thinking of my differential diagnoses. So what could cause hind limb weakness? Is it neurological? Is it musculoskeletal? Is it metabolic? I mean, if I saw something like this in just one individual cow, well, I might think perhaps it's a sciatic or tibial neuropathy caused by a bullying injury. But in this particular situation, that didn't really fit the clinical picture. Just at the time that the farmer reported this, this to us, he had a down cow that was consistent with this syndrome. So this particular down cow that was presented to us had bilateral mild flexion of the metatarsophalangeal joints for 3 weeks prior to going down. She became sternally recumbent at 120 days in milk. She was bright, alert and reactive. She was able to crawl on her belly. She had a normal heart rate of 70 beats per minute, a normal respiratory rate of 30 beats per minute, a normal temperature of 38.8 degrees, and she had muscle fasciculation over both shoulders. So really, after physical examination, there were really only 2 problems for the problem list, which was recumbency and the muscle fasciculation. She had been down for 36 hours at the time that we saw her. So given the underlying herd situation, we thought, well, what we really need to do is start off with a full haematology and biochemistry panel on this cow and see if we can get some clues. So on the right here, we have the haematology results, and all the haematology really showed was a neutrophilia and lymphopenia that was consistent with a stress leukogram, and a hyperproteinemia that was consistent with dehydration, so probably indicating that her nursing it over the last 36 hours probably wasn't satisfactory. Biochemistry results showed a moderate elevation in AST. Interestingly, the CK was within the normal range. A low albumin to globulin ratio, and a moderate hypophosphatemia. So at this point of time, we've just got to stop and remember that just because this one cow was moderately hypophosphatemic, that doesn't give us a definitive diagnosis at all. I mean, to me, it's just a small clue that tells me that, okay, maybe we need to have a look at the macrominerals. So we just need to keep in mind, hypophosphatemia has been reported in clinically healthy cows in the literature and is particularly common in clinically healthy periparturient cows. So there are studies that show that, that particularly on the day after parturition, hypophosphatemia is very common in normal ambulatory cows. Also very common in cows in the first 20 days in milk. We also need to keep in mind that this cow's been down for 36 hours. So is she hypophosphatemic simply because she's been down for 36 hours and there's been a decrease in feed intake while down? We also need to keep in mind that this blood test was only from one cow. So does she represent the syndrome in this herd or not? So we don't really know. So my next step was I wanted to model the herd diet to estimate the dietary macromineral status. I did this using CPM dairy. And so my first model was just a model based on the average cow in the herd. So the average cow in the herd was 190 days in milk, producing 22 litres per cow per day, had a dry matter intake of 18.3 kilograms of dry matter, of which 9.6 kilograms of dry matter was concentrate and 9.7 kilograms dry matter of Kikuyu pasture. I estimated the dry matter intake of Kikuyu pasture just by calculating how much Kikuyu pasture would need to be eaten to make the average cow energy balance neutral. So basically, by calculating, well, how much Kikuyu would she need to eat based on 75 megajoules per cow per day of maintenance energy plus 5 megajoules per litre of milk as milk energy. And I entered all of this data into CPM dairy. I didn't do any feed tests. So this is just a model based on assumptions. We used product specifications for the acid buff and the micromineral supplement. We used feed tests that had been done on the same feed sources on other farms for the wheat and the dry distiller's grain, and I used CPM dairy specifications for most of the other ingredients in the diet. And this is what I ended up with, and it doesn't look very spectacular at all. I've got a little asterisk next to sulfur there, and that's simply because a model is only as good as the inputs that go into it, and in this particular case, my product specifications for acid buff and the micromineral supplement made no mention of sulfur, so I can probably assume that that sulfur is probably a little bit higher than what I've got here. So the only thing that really stands out is it suggests that the sodium in the diet is below NRC requirements for the average cow in this herd, which to me, I sort of think, well, what does that mean? So I needed to do another model. So next I did a model based on the peak lactation cow in this herd. So in the second model, we did a cow that was 60 days in milk, a cow that was producing 40 litres per cow per day. Although the average production was 22 litres in this herd, this farmer did have some high production cows. I estimated dry matter intake to be 22.7 kilograms of dry matter, and I came up with this estimate by using potential DMI of 3.5% of body weight. And although cows can occasionally go higher than that, I thought given that the dietary forage was Kikuyu, that a cap at 3.5% was reasonable, given that Kikuyu is a high NDF pasture. And so these are the results that I came up with in the second model. Again, the sodium is still well below NRC requirements, but the calcium and phosphorus are now starting to head into below 100% territory. When I just adjust that model slightly for a 45 litre per cow per day, that model shifted even further to a calcium requirement of 88% and a phosphorus requirement of 91% of requirements. So I'm starting to think, right, the macro mineral content of the diet is probably okay for the average cow, but it's probably not quite okay for the peak lactation cows in this herd. So I use the model to then work out, well, what should I advise the farmer to do? What corrections do we need to make? So we increased the salt from 11 grams per cow per day to 100 grams per cow per day. We increased the limestone from 11 grams to 70 grams per cow per day. And we added dimagnesium phosphate at a rate of 60 grams per cow per day. And in Model 2, this increased the calcium in the diet to 123% of requirements, the phosphorus to 112%, and the sodium to 114%. And what was fantastic about this case was within 3 to 4 days, the farmer reported that all of the 6 cows that had mild unilateral or bilateral flexion of the metatarsophalangeal joints in his herd at that point in time resolved. Basically, all of the affected cows in his herd got straight legs. And this case was seen 17 months ago, and the farmer has reported that he hasn't had any further cases since he made these macromineral corrections in the diet. He also hasn't had any mid-lactation down cows that are consistent with this syndrome either. You know, he's only had those periparturient down cows that dairy farmers will see from time to time. So, conclusions from this case. So, the really fantastic response we saw to correction of the macromineral supplementation indicated that inadequate dietary macromineral content was responsible for this syndrome, or at least played a role in this syndrome. I don't, though, have evidence to prove that hypophosphatemia is characteristic of this syndrome, because all I tested was one down cow that had been down for 36 hours. In hindsight, I'd like to think that if I could go back in time, that I may have taken blood from those half a dozen ambulating clinical cows and perhaps a few other cows of similar days in milk in the herd, but I didn't. So the benefit of using a dietary model approach. So this was a really rapid method to investigate whether nutritional factors may be contributing to a disease scenario. This down cow presented at 2 p.m. on a Friday. We were able to really quickly get the blood to the lab by 4 p.m, get results that day, do a model, and by Monday morning we were able to report back to the farmer and he was able to make changes that week. And the other nice thing about a model is you can then make changes to the model to work out, well, what should you do to try and correct this problem? The limitations, though, of the dietary model approach is that a model is only as good as the input that goes in. So although I have this model and I feel that it showed what the problem was, I just have to keep in mind that we didn't carry out any feed tests, and we just need to take some of that information that came out with a grain of salt. But despite that, I think it was a very useful approach. So I suppose just finally, my hypothesis is that this syndrome was caused by a combination of interacting factors. The fact that we had cows that were just past peak lactation, so high milk production was a factor. Inadequate macrominerals was a factor. And I mean, we had 3 macrominerals that were all below NRC requirements for those peak lactation cows. So whether there was an interacting effect between those macrominerals can't be proven, but is suggested by this case. Is there time for questions?